recent developments in nanotechnology for cancer.
The human body is the world of trillions of cells who are born, grow, have families, get old, and die every day. Life is happening every second inside these worlds, where cells live happily. But cells often have to face many dangers, enemies, which menace the human body, powerful armies who threaten to destroy the beauty of every single cell, and one of the most deadly enemies is called cancer.
Cancer is a group of defined cells which are part of a rebellion to conquer the human body. This group doesn't follow the signals that rule the normal cell's behavior. The story begins when rebellious cells multiply and form a clump of cells called a tumor. Some groups of cells are pacifists who gather only to have a good time. They are called benign tumors. Other, more aggressive cells are called malignant tumors, which invade the surrounding cities of cells, called tissues. They can also spread to faraway countries, called organs, via the road of the body, called the circulatory system. This phase of the invasion is called metastasis.
The formation of these rebellious groups begins with a single cell, which starts to act abnormally due to changes or mutations in the DNA code that governs the functioning of the cell. These mutations are provoked by evil agents called carcinogens, which can come in the form of radiation, chemicals, and viruses which damage their DNA. Other carcinogens are hormones that help the cancer armies produce more troops. Most cancer armies develop as a consequence of multiple abnormalities in the cells that influence them to divide aggressively and spread.
Tumor progression continues as additional mutations occur within cells of the tumor population. Descendants of the first mutated cells will continue dividing faster and faster. As the worst, most chaotic cells divide the most and start to take over the tissue. More mutations develop in new cells, and this cancer becomes increasingly malignant.
Cancer armies can produce their own soldiers with growth factors, signals that tell cells to grow and make more of themselves. Abnormal production of a growth factor by the cancer cells lead to continuous self-stimulation of cancer cell division, less dependent on the signals and rules of the human body.
Malignant cells also generally produce machines called proteases that digest the materials that surrounds them, allowing cancer armies to more easily invade adjacent normal tissues. Then the cancer produces growth factors that force some cells to grow into transporters called blood vessels that supply oxygen and nutrients to the armies. This phase of the invasion is called angiogenesis. It allows cancer to expand through the circulatory system, conquering everything in its path. This final phase is known as metastasis.
There are 552,200 deaths per year in the United States, caused by approximately 100 types of cancer. Malignant tumors come in three types: carcinomas, sarcomas, and lymphomas, each with a powerful arsenal of weapons to destroy the human body. Carcinomas arise from rebellious city walls or borders of tissues and organs, called epithelial cells. 90% of all cancer invasions are carcinomas. Sarcomas, which attack connective tissues such as bones, muscle, and cartilage, make up 2% of all cancers. Lymphoma armies arise from blood-forming cells and cells of the immune system. These make up 8% of all cancers.